Welcome back, friends. I think that by this time you might have gone through the part one of this fluoroquinolones discussion, right? Now, if you have followed the part one, okay, then just move on to the second part because we have still few things left, okay, which requires to be incorporated in our discussion now, right? Okay. Now, in continuation to our previous ACR study, so we are done with in part one. While watching that video, you can find the description was given which is pertaining to this part, right? Now let us move on to this part, right? Okay. Now coming to this C5 portion. So what they observe that here, the R5, if the pattern of substituent at R5 is found to be an amino, it is found to be beneficial. That means amino substitution at C5 is found to be beneficial towards the bactericidal as well as bacteriostatic action and all, right? Okay. Moreover, I'll come to it. Let us just come to this point. Then only I'll just tell you what is the significance of putting an amino at C5. Okay. And what they observe that whether now apart from this amino, is there any other substituent that can be a good alternative to this? So with that, they came to know that they have just made an order of activity. It is the NH2, then lesser activity or lesser beneficial is found to be the halogens and all, right? So NH2, fluoro, so these are the kind of substituent, but in the entire pool it is the NH2 that should be on top, right? So that should be the primary choice here, right? Okay. Now coming to this R6. So what they observe that the R6 actually the modification which was done long back at this position was found to be monumental. Why I'm using this monumental? Because the moment they substitute, because the one which with which they started their business, that is nalidixic acid, there was no substituent, okay, that is there, or there is no electronegative atom which I should bring here, right? There was no electronegative atom which was there at this sixth position, right? Okay. The moment they just inserted a fluoro here, suddenly what they found that suddenly lipophilic nature of the drug raises, and it is out of that lipophilic nature it was exploited, where just what they observed that the moment they inserted a halogen as fluoro here, they observed that out of its increased lipophilicity it can readily penetrate the bacterial cell wall, and they are getting the the onset of action is found to be immediate that time. Okay, so that means the moment this C6 position is substituted, is inserted with the fluoro, what they got an increase in lipophilic nature of the entire drug, and it is with this increase in lipophilic nature, okay, that time the fluoroquinolone has become an eligible candidate to be accessed or to be accepted by the bacteria in no time rather. Why? Because the rate of penetration, okay, the rate of penetration is found to be faster. Why? Because it is out of this lipophilicity. So that means it is the fluoro that should be kept. That should be kept, okay, that was kept, that is kept, and that should be kept in the fluoroquinolones which are coming, okay, or which are about to come or about to land rather. Okay, so we are done with this, okay, C6. Now coming to this C7. Let's move to the position 7, right? 7 position. Okay. Here also I think that a substitution has to be made here, right? Okay. What they observed that substituting position 7 with a heteroaryl, and the heteroaryl was nothing but piperazine. So what they observed that substituting position 7 with a heteroaryl as piperazine, okay, fetched them a landmark development. Why? Because the moment they did this particular substitution at this position, they got the spectrum of activity was found to be broadened. Okay, but okay, the story was not ended there. There was some lacunae, and what was the lacunae? The lacunae was, though piperazine, insertion of a piperazine fetched them a particular agent which was found to be a broad spectrum, but still there was a side effect. The side effect was CNS toxicity. Now the question is, why CNS toxicity emerged? Why CNS toxicity emerged? what they observed that piperazine not only raises the the spectrum of activity, but also it is just targeting. So piperazine not only increases the affinity of this fluoroquinolones towards the DNA gyrase or topoisomerase 4, but also it develops an affinity towards GABA receptor, and thereby, while making an extra affinity towards GABA receptor, it causes the CNS toxicity. So this was the outcome. So through that investigation, they came to know that piperazine, while being kept at this position, though they got broad spectrum, but still, as because the side effects still there, it is found to be highly undesirable. So in order to counterbalance the side effects, so what they did, they just substitute what? They just substitute the other terminal of piperazine with a methyl. The moment they brought methyl at this position, sometimes you can find the methyl to be placed at this position as well. Okay, CNS toxicity gradually depletes, and at a particular point of time, what they observed that it was totally abolished. Only broad spectrum. What? Broad spectrum antibiotics, right? There was no broad spectrum antibiotic with CNS toxicity, right? So that means you have to keep a piperazine, okay? With that you are getting what? Broad spectrum. But make sure that the piperazine should be substituted. And these are the locations where exactly you have to place the methyl group or smaller alkyl, okay? So that we can avoid the CNS toxicity and all, right? So this is about the position 7 and all. Yes, we have some other choices as well. The other choices as heterocycle are found to be like pyrrolidine, sometimes pyrrolopyridine as well, sometimes azepine as well. Azepine, the drug which was invented in the year of, which came into the market in the year of 2009. In that case, the position 7 is substituted with an azepine, right? And the name of that drug is basifloxacin. So basifloxacin is a drug, it's a broad spectrum fluoroquinolone antibiotics, right? Which is not having piperazine. Instead of piperazine, there is a azepine. Azepine, that means a 7-membered with a nitrogen, with a substituent, right? So with that we are done with the position 7 substituent pattern and all. Now we are left with what? The position 8. Initially I told that the X can be CH, most of the time CH, and in a minor occasion you can find it in the form of a nitrogen. When it is nitrogen, it is 1,8-naphthyridine. When it is CH, it is basically quinolines or quinolones, right? Chalo. Now coming to, if it is found to be CH, because we should focus on those entities, okay, in which CH is found to be predominant, right? Okay. So CH is found to be frequently been found, okay. So that is why we are just keeping here CH. Now the thing is that there was a double bond here, so that means there is only C, and I have put here one substituent R8. So what they observed there, that means the substituent pattern we should know, the pattern of substituent. So what they found that initially they tried with halogen, that means fluoro was taken. The moment fluoro was taken, what they got, they found that gram negative affinity increases. It is the gram negative affinity that increases when position 8 of fluoroquinolone is substituted with a fluoro, right? Okay. Now apart from this gram negative or anti-pseudomonal affinity, anti-pseudomonal effect or pseudomonal affinity, keeping the fluoro at position 8 increases photosensitivity. That is one of the undesirable effect, right? Though we are getting anti-pseudomonal effect, but still, as because of this fluoro there is another thing that is parallelly growing. That is nothing but what? Photosensitivity. Okay. So that means this has to be avoided. It has to be avoided. That means it can be replaced. But initially they thought, let us just keep that one and let us just deal with the adverse reaction. Okay. While dealing with the adverse reaction, they just kept fluoro as such. And on top of it, just put amino. As I told, that insertion of an amino at position 5 leads to beneficial effect, right? It is the amino that counterbalances the photosensitivity. That means, though fluoro is there, despite of the fact knowing that fluoro causes what, apart from its beneficial effect, it produces what? Photosensitivity reaction, right? But the thing is that while keeping fluoro as such, we can avail the service, and the adverse reaction is counterbalanced with the amino. So that is why fluoro, you can keep fluoro, but provided you should have an amino to counterbalance the ill effect as developed by fluoro, right? Okay. So it is the fluoro, what they observed, that fluoro while being substituted at position 8 or inserted at position 8 leads to increase in gram-negative affinity. Whereas it is the methoxy, let me just keep it like CH, right? Because most of the times it is CH, right? In exceptional or few occasions you can find it nitrogen, right? So now sometimes it is OCH3, but the moment fluoro is replaced with OCH3, gram-negative affinity drops, whereas gram-positive affinity grows. That means with that we can just draw an inference. What is that? Fluoro raises gram-negative affinity, methoxy raises gram-positive affinity, right? Fluoro, apart from gram-negative affinity, causes photosensitivity, counterbalanced by amino. That's all. So we are done with these things, right? Okay. Now, so what they observed, okay, in addition to this, okay, so this is about your general discussion, right? So we are done with all the positions and all the kind of substituent that each and every position can hold, or the kind of substituent which is found to be rejected by the respective locations and all. This we have seen, right? Now we'll see some general thing, right? That means some extra feature while being brought in this skeleton may leads to a broadening of the spectrum and all, right? Broadening of the antibacterial spectrum and all. Okay. Now, what they observed that it is the, say earlier it was X. We know the pattern of X, CH or N. What they observed that when X was found to be nitrogen, in addition to the beneficial effect, lots of untoward effect emerged, right? But the moment they replaced the nitrogen with CH, what they observed that gradually the side effects are found to be nullified. Okay, gradually that means it diminishes the side effects, right? Okay, so that means here it is not the nitrogen, rather the methane should be kept here, and the methane should be substituted. Okay, now coming to this the extra feature, right, which we need to bring, right, so that we can make the activity even better, right? Okay, what is that? What was that actually? They did the modification long back, right? Okay, in early 90s and all. Okay, so sometimes it was found that the position 8, that means the C8 as well as the N1, right? These two, it has been bridged, or they just bridged this 8 carbon as well as the first nitrogen. So how the bridging was done? So the bridging was done by means of like this, right? So that means now it has become what? Ox-aza-in. So this is how they made the bridge. That means they just tried to bridge, to form a bridge between the C8 and N1. So it is the N1 and this one is the C8, right? So in between a bridge, the bridge is nothing but ox-azine, ox-aza-in. INE for 6-membered, aza for nitrogen, O for oxide. And moreover, here, the moment they did this kind of modification, they just inserted one methyl here. Okay, as such, methyl will not aid up the process. Only thing is that when you found a particular methyl to be here, that means it just generates an asymmetric center here or a chiral center here. It is because of the chirality we can found, or we can give the drug in the form of a racemate or in the form of a single enantiomer. This is the thing they did in case of ofloxacin and levofloxacin. Yes, levofloxacin. So ofloxacin is found to be the racemic mixture of the entire fluoroquinolones, whereas it is the levo form of ofloxacin that, as we have a chiral center here, and it is because of the chiral center we are just from that racemic mixture we are just isolating the levo form. And what to observe that it is the levo form of ofloxacin that is found to be 2 times more active than that of ofloxacin. Got my point? Okay. So with that, they are done with this kind of things and all. That means it is also one of the strategy, okay, which is quite often being brought. And what they observe that ofloxacin is you see till now ofloxacin is there in the market. It's raining like anything, right? Ofloxacin, ornidazole, right? The combinations are being given, and it is out of its spectrum only, right? It's a broad spectrum antibiotic, fluoroquinolone antibiotics, right? And safe also, right? Safe also. Now, so with that, this is found to be one of the additional things. Okay, another thing which need to be kept in mind that you are not supposed to take fluoroquinolones along with antacids, hematinics, or your even dairy products as well. Why? The cause is, it is the fluoroquinolones. They are having a tendency to form chelate, and they make the chelate with a polyvalent ions like Mg2 plus, Mg2 plus, Fe3 plus. These are the things. Calcium, Ca2 plus. Okay. So that is why it is strongly recommended that while taking fluoroquinolones, at least 1 hour before or after, you are not supposed to take hematinics, any iron tonics and all, or any antacids, or any dairy products. Why? Because this is the portion which forms the carbonyl and the carboxylate. Okay. How? Suppose ki the metal ion is found to be like this. Okay. And carboxylic should be in the form of what? Carboxylate. So what happened here? Like this, and this will be like this. So with that, there is a formation of a chelate. Okay. And once there is a formation of a chelate, definitely, okay, it is well guessed that yes, it can cause some serious problem to the system as well, right? So that is why fluoroquinolones should not be taken along with this kind of things. That means concurrent administration of antacids, then hematinics, then any dairy products is found to be not recommended, okay, while a subject is supposed to take a fluoroquinolone antibiotics, right? So this is how more or less we are done with the ACR of fluoroquinolones, right? Okay. Now, so it's an extensive discussion because fluoroquinolones, say long back, they have started their journey from since 1962. Now it's 2020. That means already 58 years passed by, still they are making fluoroquinolones. Why? Because as they are providing us a major benefit, what we can say. So that means we can avail major benefit out of these applications and all, right? And out of their, owing to their broad spectrum and all, this is the drug of choice in so many infections, right? Starting from respiratory tract infection to STD, that is sexually transmitted disease, to eye infections. See, they are having lots of applications, right? Okay. So now let us just, as we are doing in our regular videos, let us just in a nutshell what all we studied. Okay, let's see one by one. So what all we studied, starting from the indications, we know about A, B, C, D, E. I don't have to tell it again, right? Apart from that, respiratory tract infection, then urinary tract infections. These are the clinical indications and all. Now coming to the mechanism means basic target is found to be topoisomerase 2 as well as topoisomerase 4. It is the complex between DNA and topoisomerase 2 and 4. Okay. Basically fluoroquinolones, they are just stabilizing this complexes and all, and they are affecting what the replication as well as transcription, and as a result of it they are just arresting the DNA formation and all, right? And they're basically bactericidal and bacteriostatic. Now coming to the ACR and all, we have seen the essential pharmacophore present in the fluoroquinolones is pyridone, 3-carboxylic acid, okay, carboxylic acid. What is the other region? That is C1. Okay, C1, the substituent. We talked about the substituent, right? And what we found that it is basically increases the potency, right? Now coming to C2, no such substituent is found to be permissible there, but often C1 and C2 is bridged, right? So bridging can be done, right? Bridging can be done. Now coming to C3, there you should find a carboxylic group or carboxylic group. Okay, no such other group like your sulfonic acid, then phosphonic acid or tetrazole. Okay, neither sub replacement nor derivatization, both are found to be not permissible here. Coming to C4, here also a carbonyl, strictly C double bond O, no thioxo and no sulfonyl, right? Okay, coming to C5, here we have seen the importance of amino, right? We have few more substituent as well like fluoro and all. So amino basically counterbalances the photosensitivity reaction of the fluoro while being placed at C8, right? So amino often beneficial. C6, we have seen that fluoro, right? fluoro is basically, it just increases the lipophilicity of the whole drug, and as a result of it, which ultimately leads to what? A better penetration to the bacterial cell wall and all, right? And now coming to this C7, we have a piperazine, right, at a heterocycle, but you're not supposed to keep the piperazine as such. It should be substituted. You can, the positions which are found to be targeted is found to be the other terminal, that is N terminal, at the same time few carbons as well, and that too with a smaller alkyl methyl, right? And then only you can avoid the CNS toxicity of this piperazine, right? We have few more alternatives like your pyrrolidins, then your pyrrolopyridines, sometimes your adipines as well. Now coming to C8, there we found that insertion of a fluoro, though we can get a better affinity towards gram-negative one, but the thing is that additionally we have an untoward effect, right? Your this things like photosensitivity rate, okay, which can be counterbalanced with by placing an amino at C5, right, as I just told a few minutes back. Now apart from that, we have seen that it is the methoxy that often raises the affinity towards gram-positive, right? And in addition to this, we have seen that if it is the C8 as well as the N1, sometimes they have been bridge, right, or there is a bridge between these two locant numbers, right, and which eventually leads to the formation of a blockbuster drug, that is ofloxacin. We have seen that it is the ofloxacin. Out of its chirality, it can be given in the form of a racemic mixture, or sometimes in the form of an enantiomer, that is your levofloxacin, right? And it has been observed that it is a levo form that is found to be two times more active than the ofloxacin. And coming to this, the contraindications and all, we have seen that it is the carboxylic group being placed at position 3. It can access the carbonyl group, and both of them can grab polyvalent metals and all, and thereby forming a chelates, right? And that is why you are not supposed to take the antacids, dairy products, at the same time hematinics along with the fluoroquinolones, right? So with that, basically we are done with the overall ACR of fluoroquinolones, right? So I think that with that we are done with this, but I strongly recommend you to go through, to just refer books and all. We have good books like William Foy, we have good books like Graham L. Patrick, we have good books like Wilson and Gisbol, Medicinal Chemistry, right? Please do refer those books and all. Okay, this is just a brief discussion, right? You can gather so many informations just simply going through those books, and we have several videos on fluoroquinolones that is there in YouTube's and any other networking sites and all. So you please go through it so that you can just cement your understanding and all. Okay, so with that, I'm done with today's discussion and all. Hope you like my video, and if you really like my video, please don't forget to press the like button, and moreover, please do subscribe my channel so that I can grow along with you, and please leave your comments, right? Your comment is very much essential for me, just to make the presentation more attractive and more informative. Thanks a lot. Thank you.